Well, also this week, a bipartisan healthcare working group created by Republican leaders in the House and Senate met for the first time. Jason Doyle reports on their agenda heading into the next legislative session.
And so begins the first bipartisan legislative healthcare working group meant to study the situation Oklahoma is in and how to improve health outcomes through policy. This comes in the shadow of efforts to get Medicaid expansion on the ballot for voters to decide. The working group is bringing together all sides to find solutions to health disparities.
So bringing the House together, the Senate together, Democrats, Republicans, and the governor's office. This is not the normal operation of business, and I hope that the people of Oklahoma understand that what we're doing here is not only something we find important, but something that we're really serious about tackling.
The goal for the working group is to form policy recommendations for the legislature to address during the next session.
Because it is not just about health care, it's not just about doctors and hospitals and insurance companies. This is about the fact that the state of Oklahoma is one of the least healthy states in the nation.
Oklahoma's health ranking is 47th, not an easy starting point. Traditionally, the legislature has approached health care through a financial lens.
And so everything is driven by that question. How much does it cost? How can we afford it? It's an important question, like Senator McCourtney alluded to. But the question that we're asking here is, how do we make Oklahoma a healthier place?
The first agencies to provide information to the working group are the Oklahoma State Department of Health and the Oklahoma Healthcare Authority.
Oklahoma, unfortunately, has been in a steady state of decline in our rankings. Although there have been years that have perhaps seen some gains and some losses, overall, as you look at that line from 1990 to present day, it has been a steady decline.
One of the biggest obstacles for Oklahoma to get a higher ranking is smoking and tobacco product use.
1 in 5 Oklahomans across the state are actively using tobacco products.
Other issues causing Oklahoma's poor ranking are youth smoking, higher obesity rates, adverse childhood experiences, and a large number of uninsured. In fact, the health department says 3 behaviors, tobacco use, poor diet, and sedentary lifestyle, along with 4 chronic diseases, cardiovascular disease, cancer, diabetes, and lung disease, are connected to 65% of the deaths in Oklahoma. This comes at a time when the Oklahoma Healthcare Authority insures 1 in 4 Oklahomans.
And 63% of those are children. So our total population in Oklahoma is almost 4 million, just under. And for state fiscal year 2019, so we do have that just ended a few weeks ago, we are just shy of 1 million members.
Audra Cross with the Healthcare Authority says that 1 in 4 average membership figure stayed steady through the state's population increases. The working group now has a baseline of information.
We kind of had to start at the ground floor, and there are a lot of numbers, a lot of stats. I'm leaving with a headache, which probably means that we did our job well today.
Medicaid is not something that people think about a lot, and unless you're on it. But so we needed to lay a groundwork for who's covered by Medicaid and health statistics on our state.
Senator Carrie Hicks says she has a passion for health care because her son has type 1 diabetes. She believes the meeting was a good start toward bipartisan solutions. To her, it also demonstrated that state agencies like the Health Department and the Healthcare Authority will have an important role to play.
I think it's really important that we draw distinctions between those 2 agencies and what they do, but I think this also highlighted how we need those entities to be working together moving forward.
Tackling issues like smoking and obesity will be key to better outcomes.
We know that there's a lot of behaviors that Oklahomans have typically engaged in that increase risk factors for some really chronic conditions. So I think that this working group was really looking at a holistic approach to not only, medical care or clinical care, but also, what are the ways that we can really encourage and motivate individuals.
Many of the figures, like the uninsured rate and shorter life expectancy, shocked Representative Andy Fugate. He says Medicaid expansion is only one part of the solution.
Figuring out better health outcomes. Obviously we'll be taking a look at Medicaid expansion, and that will have some impact on what we do, but if we just focus on Medicaid expansion, then we haven't done our jobs.
He also feels some are trying to blame lifestyles for Oklahoma's poor rankings, but it goes beyond that.
The problems we have extend far beyond behaviors in this state. We have medical deserts in this state, people who have to drive an hour and a half to get to quality care. And so to just say, hey, you know, we got a bunch of sedentary people here and they're causing it to themselves is just wrong.
The Healthcare Working Group will meet every week for the next couple of months. The next issue they'll discuss, healthcare in Oklahoma's prisons. I'm Jason Doyle, the Oklahoma News Report.